Hi everyone, Dr. Callanan here. I wanted to go through a patient case. She was experiencing hair loss. She had chronically low ferritin levels. Her ferritin was extremely low. Her ferritin was 5. She was experiencing a lot of fatigue, brain fog, hair loss. She was also experiencing some digestive concerns in terms of bloating. So I wanted to go through what her GIMAP stool test showed. We'll walk you through it, and then I'll share as well what we did for a treatment plan and things that you can consider. So whenever somebody has extremely low ferritin or low levels of iron, and that's causing their hair loss and their symptoms, we want to understand why that is. She was consuming a lot of red meats in her diet. So she had a diet rich in iron. I was like, what is going on? Why is your iron so low? Her menstrual cycles weren't significantly heavy. So we wanted to look at, is there anything going on in the digestive tract with the GI-MAP stool test that could explain why she was not absorbing her iron? So this is what the GI-MAP stool test looks like. This is the first page, but what I actually do is I start with the bottom page to look at the intestinal health markers to get a good idea of what's going on. Steatocrit tells us about the amount of fats in the stool. So when you eat fats, avocado, nuts and seeds, extra virgin olive oil, you should digest and absorb all of those fats, and we shouldn't see any fat present in the stool. And that's what we were seeing here. Her steatocrit is less than detectable limit, so she's doing a great job with fat absorption. When we look at elastase, this is a marker of pancreatic digestive function. So how well are you digesting proteins, carbohydrates? This is also really important because if it's low, it could point towards low stomach acid. And if you don't have enough digestive enzymes, if you don't have good digestive capacity, then what we can see is undigested foods ends up in the stool, and it's also harder for you to absorb your nutrients like iron. So she definitely would benefit from a digestive enzyme. We started her with betaine HCl plus pepsin, and we're going to utilize that in addition to our iron supplement so she absorbs it better. Beta-glucuronidase and fecal occult blood, these are markers that would have an increased association with colon cancer risk. These ones look good. There was no microscopic blood present in her stool. Secretory IgA, this is a marker of her immune function. Anti-gliadin IgA is a marker for gluten sensitivity. She was consuming gluten. She doesn't look like she has a significant gluten sensitivity. We ran a celiac panel to make sure that wasn't the reason why she wasn't absorbing her iron. That came back negative. So the amount of gluten that she was consuming in her diet, I feel that her body was tolerating just fine. Now, one of the other markers that you'll see here, zonulin, is a marker of leaky gut. So the spaces between your intestinal cells should be nice and tight, where we're not seeing undigested food particles, pathogens getting through, because right behind the intestinal cells is the bloodstream. We're starting to see that these spaces are opening up a little bit. And this can cause a reaction to multiple types of foods. So in cases like this, I first heal the leaky gut, which sometimes a gluten-free diet can help with, but we're also going to use key supplements like zinc carnosine, L-glutamine, and help her digest her foods properly. And you'll see a step-by-step in how we approach this. Some practitioners would run a food sensitivity test to see what types of foods is she having an inflammatory reaction to. When I see elevated zonulin or those spaces are open, we first need to heal those spaces before we run a food sensitivity test. Because in my experience, if you have leaky gut, what I see on food sensitivity testing is 20 plus foods all come back high. And it's not the foods that are necessarily the problem, it's that they're getting to the wrong space and creating an immune reaction. So first thing, we're going to go through a step-by-step protocol. We can consider food sensitivity testing at the very end when the leaky gut is healed, if she's still having some problems or concerns with different foods. So first thing that I'm seeing is she doesn't have great digestive capacity. That can explain the lower amounts of iron or the issues with absorbing. And I'm also seeing that she has this leaky gut. When we scroll back up, we have a look at the first page. These are all the major pathogens. Everybody agrees that these ones cause significant diarrhea, signs and symptoms. These ones are all less than detectable limits for her, so that looked good. I was also curious if this patient had H. pylori. H. pylori is a bacteria that lives in the stomach that can interfere with your ability to absorb nutrients and is associated with chronic iron deficiency. She does have the presence or is a carrier of H. pylori, but it's low levels. And we do know that 50% of the population can be carriers of H. pylori. It causes no problems. Now, the virulence factors tell us how likely is the particular strain of H. pylori that she has to cause issues. right? So there's different strains of H. pylori. Some are more associated with ulcer formation. Some are more associated with chronic infections. Some are more associated with certain types of cancers, stomach cancer, cancers in the duodenum and jejunum. She does not have any of these virulence factors, which is great. They're all negative. I actually don't think that we need to address this. I think she's just a carrier and it's not impacting her. When we look at her normal bacteria, so this individual was also struggling with resistant weight loss. Now, a couple things that I'm noticing. The Bacteroides that's high, this can occur in individuals who are struggling with constipation and they're not digesting their foods well, which we saw with the low elastase, hence the digestive enzyme. She's also low in two really important bacteria. When these bacteria are low, we actually see more cases of resistant weight loss. So this is something that we absolutely need to address. Akkermansia muciniphila means mucus loving. Akkermansia breaks down the mucus layer in the digestive tract. And when it does that, it leaves crumbs lying around for other bacteria to use as a food source. It's a really important bacterial species that we need to see at high levels. This study here shows that lower amounts of Akkermansia muciniphila is associated with obesity, diabetes, inflammation, and metabolic disorders. The lower amount of Akkermansia, the more likely you're to struggle with weight gain, as well as inflammation, and metabolic disorders is pointing towards insulin resistance, prediabetes. Now, I find this particularly fascinating because it shows that it's not just about the types of foods that you eat, but we have to take our approach to weight management one step further and look at the gut microbiome. How do we raise Akkermansia? Things like Bifidobacterium B420. It's a very specific strain of probiotics that has been shown to raise Akkermansia. Interestingly enough, one of the ways that we feel metformin could be helping with individuals' blood sugar management is metformin actually creates a positive increase in Akkermansia, which I find very, very interesting. You want to avoid a high-fat processed food diet, avoid heavy alcohol consumption, anti-inflammatory diet, more healthy prebiotics like glucomannan, pectin, more antioxidants in your diet, so things like berries, resveratrol, curcumin, and my favorite way to increase Akkermansia is with Bifidobacterium probiotics. So I find that piece of research very interesting. If we go back to her GIMAP, we're also seeing lower levels of fecal Calibacterium prausnitzkii. This is a really important bacteria because it produces something called butyrate. And butyrate is actually something that the intestinal cells will use as a food source. So the intestinal cells provide a home for the bacteria, and then the bacteria make things to keep the intestinal cells healthy. We really need to have great levels of fecal Calibacterium prausnitzkii because lower amounts are associated with more inflammation. Treatment for low, this type of bacteria does not do well when there's inflammation present. So anti-inflammatory diets, curcumin, quercetin, resveratrol, and again, Bifidobacterium B420 probiotics can cross-feed this bacteria. So we're going to consider that for her as well. Overall, we're seeing higher amounts of healthy normal bacteria. Higher amounts of bacteria, she does not need a broad spectrum probiotic at a high dose. She just needs the Bifidobacterium B420, or just that one in particular, I feel would have a therapeutic benefit for her. In terms of opportunistic bacteria, these are bacteria that are fine to have low amounts, but if the right opportunity presents itself, they may overgrow. And when these types of bacteria overgrow, we can see more abdominal pain. Sometimes we can see diarrhea. Sometimes we can see constipation. This is seen more commonly in patients who are struggling with IBS. Now, the high bacillus species, this could have been a result of a high amount of fermented foods in the diet, or if some patients didn't stop their probiotics prior to testing, we can see that. She didn't do that. In addition, we can see higher amounts of bacillus in patients who are not digesting their foods well. And we also saw that she has the tendency to not digest her foods well with the elevated elastase. The high streptococcus, we can see, again, more inflammation in the gut is associated with higher streptococcus. So we want to look at that anti-inflammatory diet and reduce inflammation in the body. as well as we can see in some cases higher streptococcus in patients who are struggling with small intestinal bacterial overgrowth. In terms of our treatment plan, we keep it very simple and straightforward. I don't like to overwhelm individuals with too many different products, and I'm going to show you the step-by-step approach that we took to address this. Fungi, yeast were normal, viruses were normal, parasites and worms were normal. So if we go over to her treatment plan here, this is what we're looking at in terms of treatment. We saw that there was higher amounts of bacteroides, and all of my patients will receive this as part of a summary when we do the GIMAP test. This is what they get. So they get to see, okay, why was the Akkermansia low? Why is it important? She has low fecal calibacterium Prodznitski. She has some opportunistic bacteria, the higher amount of zonulin. But this is the treatment that I wanted to focus on. Step one, we need to remove the overgrowth. We need to address the inflammation, and we need to help get the foods better digested with a digestive enzyme. In terms of removing overgrowth, I use a combination of 3 products, as well as we're putting her on an anti-inflammatory product called curcumin. This is the active component of turmeric. This is not something that I feel that she has to do for a significant period of time because her levels were not significant in terms of overgrowth. So we're going to do this for 2 to 3 weeks, well, 3 to 4 weeks, and see how things go in terms of her bloating. But again, we're pairing this with a digestive enzyme, betaine HCl plus pepsin, and an anti-inflammatory, because again, we're looking at trends and there seemed to be more inflammation in the gut. Step 2, once we've removed the overgrowth, we get her digesting her foods better, we're understanding that there's inflammation present and getting that down, we're going to replace the missing bacteria, the Akkermansia and the fecal calibacterium Prodznitski. This is where we're going to supplement with the tummy tone probiotic, Bifidobacterium B420. And this probiotic has some really fascinating research on it for weight management. Then we're going to treat the leaky gut. We usually use a combination product again of zinc carnosine, L-glutamine, marshmallow, slippery elm, very healing components to the GI tract. And then step 3, if she's still not feeling 100%, that would be a great time after we've healed the leaky gut to address the food sensitivities. So I hope that gives you a little bit of insight into my practice and how I look at the digestive function, the GIMAP stool test, and how we can create a custom plan specific for you to help get to the root cause of your concern. Yes, we need to supplement her with iron. Her ferritin is really, really low, but in order to provide sustainable results where she doesn't have to be on a iron supplement forever and ever, we really need to look at, okay, why was she not absorbing her iron? And I think this GIMAP test result was very interesting and it was fascinating. And again, pretty straightforward with step 1, 2, 3. And it's one of my favorite tests to run. So if you're interested in running this test, if you're interested in learn more, please reach out to my patient care coordinator. Her name is Alison, and we can have this set up for you. I hope you found that interesting and helpful. I certainly did. And we'll talk soon.